now had your successful total hip replacement, been instructed by your surgeon and therapist, and are ready to go home. It's up to you to take good care of yourself while you recover. This video shows you the proper techniques to get back to your daily activities while your hip heals. You'll be observed for 3 months after surgery. During your surgery, some of the structures of your hip muscles were stretched, so holding them in proper alignment is important. As muscles strengthen, it will add stability to your hip. You will be allowed to return to regular activities as long as you follow these rules. Avoid extreme flexion, bending the hip more than 60 degrees. Avoid bringing your knees together. Do not roll legs inward. Use proper transfer procedures for getting into the bed, a car, or a chair. Wear the TED hose until instructed by your surgeon. Chair transfer. Slide to the front of the chair. Keep your shoulders behind your hip until you are on the edge of the seat. Keep your operated leg outstretched. Bend your non-operated leg underneath you. Sit at a dining room table or desk. Push up using your non-operated leg or your arms. Do not use your operated leg to lift or lower your body weight. Do not sit with your hips against the back of the chair. Scoot your hips forward and lean your shoulders against the back of the chair. You may want to place a pillow behind the lower portion of your back for comfort. Avoid sitting in low, soft furniture. Use chairs with arms. Otherwise, you will be leaning forward to get out of the chair. Avoid sitting more than 1 hour at a time without at least standing or stretching. Auto trips should include several stops. Do not cross your legs or sit with your knees together. Always keep your shoulders behind your hips. Do not lean forward while sitting, such as to wash your feet or to put on socks or shoes. Keep the knee on the operated leg straight and the trunk back to prevent bending of your hip when getting up and down. Bed transfer. Sit on the edge of the bed with your operated leg straight. Put your hands on the bed behind you for support. Slide back until your knees are supported on the bed. Keeping your legs apart, pivot on your buttocks until both legs are on the bed. Do not roll sideways during pivot. Lie back. To get up, reverse the procedure. If transfer is painful, have someone help you. Do not roll to your side when getting in and out of the bed. Keep a pillow between your legs until 4 weeks after surgery. Place the pillow so the entire leg is supported. 1 king-size pillow is usually okay. Relax completely for 1 hour in the morning and afternoon. You can decrease the amount of rest time as your healing progresses. Do not lie on the operated side unless your surgeon has given you permission to do so. With assistance, roll to the non-operated side. Feet should be shoulder length apart. Do not bend or flex operated hip. It is often helpful to place a pillow at your back for support. Bathroom safety. In the bathroom, an elevated toilet seat may help, as well as safety rails. To bathe, it is not recommended to sit in a tub. A walk-in shower is preferred. Extreme care should be taken when getting in and out of a tub or shower stall. Handrails, anti-slip surfaces in the bottom of the tub, a lawn chair, or unupholstered seat can be used. A handheld massage shower head can also be used. Use a bath sponge to aid in reaching below the knees. If you only have a tub without a shower, convert the faucet to a shower. Use a counter for support to take a few steps. Car transfer. When traveling by car, remember to apply transfer principles. It is easier to get in the back seat from the passenger side if your right leg is the operated leg. It is easier to get in the driver's side if your left leg is your operated leg. Transfer can be done from either side if you apply these principles. In the back seat, sit on the edge of the seat and keep your operated leg outstretched. Slide across the seat. Keep your shoulders behind your hips. Lean against the car seat. Use pillows and blankets to make you more comfortable while riding. To get out, slide out across the seat, feet first, keeping your legs apart and shoulders back. In the front seat, sit on the edge, keep your operated leg outstretched, slide toward the driver's seat until your knees are in the car. Slide your feet onto the floorboard. Slide hips over the seat. To get out, reverse the procedure. Walking aids. Your therapist has selected the walking aid best suited to your needs. If you are weight-bearing, you will require less support as your muscles strengthen. If you are limping, you will still need assistance. Your surgeon will determine when you are able to go from a walker or one crutch to a cane. Remember to use the cane on the non-operated side. Ambulation points to remember. Equal stride lengths. Heel strike toe push-off. Avoid pivoting on your operated leg. Turn towards the unoperated side. Avoid impacts, jumping, or jogging. For stair climbing, bring your operated leg up to the same step. Then, bring your crutches up to the same step. In descending, the opposite rules hold true. Place your crutches down on the step. Bring the operated leg on the same step, then bring your non-operated leg down on the same step. When using a walker, you will need assistance in climbing stairs. You must use handrails or have someone stand beside you. Walking is a good activity. Walk on a patio or porch. Do not walk on grass, gravel, or unlevel ground without an escort. Exercise. Set up a definite exercise schedule into your daily routine. Exercise only up to the point of discomfort. Have someone help you if necessary. Avoid physical fatigue. Frequent short periods of exercise and activity are suggested. Regard muscle soreness not relieved by rest or pain medications as signs of overactivity. A hot shower or rest may help. Do not increase the reps of an exercise until it can be performed without pain or fatigue. Increase the exercise gradually up to 30 times, twice daily. Bed exercises. Abdominal exercise. Lie on your back, suck in your stomach, pinch your buttocks tightly, push heels into bed, hold 5 seconds, relax. Quadriceps. Tighten the muscle on the top of your thigh by straightening your knee. Hip hiking. Make the operated leg long and the other leg short, then reverse. Do not bend your knees. Hip rotation. Lie on your back with your legs apart, kneecaps pointed to the ceiling. Use your hip to roll both legs outward and then roll back to start. Do not roll legs inward. Hip flexion. Slide the leg of the operated hip up and keep the other leg flat. Abduction, like the skateboard exercise. Slide the operated leg out and then back to the starting position. Resisted abduction. Advanced. Have someone give resistance to the outward motion, but do not stop the motion. Standing hip flexion. Hold on to a counter or stable object. Lift your knee up toward your chest. Do not lift higher than hip level. Do not force it. Standing hip extension. Hold on to a counter. Move your operated leg straight back. Keep your knees straight. Keep your feet shoulder width apart. Do not lean forward at the waist. Standing abduction. Hold on to a counter. Move your operated leg out to the side. Keep your feet shoulder width apart. Do not lean to the side. Advanced chair exercises. Do not start these until you are allowed to sit up straight. Sit in a chair, bend forward as far as it is comfortable. Lift the operated leg 6 to 10 inches. If needed, use your hands to aid in raising the leg. Complications. Dislocations. If dislocation occurs, your hip will be extremely painful and movement and weight bearing will be restricted. Call your surgeon immediately. If you observe the precautions and avoid pain, you can participate in your normal activities. Soreness is common for several months. Wound infection. Inspect your incision for an increase in redness, swelling, temperature, or drainage. Call your surgeon immediately if symptoms occur. Assisted devices include sponge, reacher, and a shoehorn. Remember, if you are having dental work or other work done, tell them you have had a total joint replacement. Thank you for taking the time to learn about your home recovery. Soon you'll be able to enjoy an active lifestyle. Remember, if you have any questions, ask your surgeon or physical therapist. On behalf of your medical team, we want to wish you a healthy and safe recovery.